Hello, my name is Vishal Patel. This is Secondhand Smoke and Public Health, my Public Health 1 presentation. I originally chose smoking as my topic, but as I did more and more research, I found that secondhand smoke was more interesting to me, as not a whole lot is known about secondhand smoke to the public as much as smoking itself. So let's get started. Number 1, public health problem. Why does this problem exist in society? Well, as people smoke and they breathe out the air, they inhale out into the open air, which gives it a lot of chances of secondhand smoke happening. People smoke frequently, and even though we've read some articles in Public Health 1 saying that teenagers smoke less, people who smoke frequently. So again, the air is still polluted with these smokers' air. How does this happen? When people smoke, they breathe out smoke that can contain more than 7,000 chemicals. This includes hundreds that are toxic and about 70 that cause cancer. This smoke comes from a person's cigarettes, cigars, pipes, or any kind of burning tobacco product. So basically, when people inhale their smoke from certain cigarettes, they inhale those same harmful chemicals that they inhale themselves out into the open air. It's pretty simple, but pretty deadly. So where does this happen? Well, secondhand smoking is unique in that it can happen anywhere. But more specifically, studies show that this type of exposure to smoke from tobacco is more prevalent in the cars with kids and also in the workplace. It makes sense in the workplace because when people are stressed or people take smoke breaks, they're around other people constantly, especially if it's indoors or in a tight area. And again, smoking with kids in the car is also very common and very deadly. What are the risks for the community in the future? There are a lot. If others inhale too much smoke, it can cause substantial and rapid cardiovascular effects, heart disease, lung disease, strokes, and cancer. And children are more susceptible to more types of problems. This can be such as ear infections, asthma attacks, respiratory infections, and a great risk for sudden infant death syndrome. About 40% of children in 2004 were exposed to secondhand smoke. Etiological factors, well, burning tobacco smoke, cigarettes, cigars, and a plethora of harmful chemicals such as arsenic, benzene, and formaldehyde, which are carcinogens that can cause cancer and other diseases. Usually the most harmful effects are on children since they're more susceptible to this, and they're also more present in more low-income communities. How to solve the public health problem? So here are descriptions of two strategies. Strategy one is through legislative action. Legislative action is taking place in the form of smoking bans in certain settings, more specifically in workplaces. There have been a lot of studies showing that banning smoking in the more workplaces have actually improved overall health of the workers and people around. Again, smoking in the workplace is pretty common, so if there are legislative laws preventing this, it can help everyone involved. And strategy two is stopping the problem at its direct source, people smoking. Many companies and nonprofit organizations are trying to stop smoking itself, which actually can help secondhand smoking since it comes from smoking. These companies, for example, use TV commercials and also hold events where nurses help educate those who smoke and its harmful effects. These commercials target teenagers and kids on young people programming in order to stop the problem at the source. They're very common nowadays and they're trying to stop it at the source. Just as before when smoking companies target young people to start smoking, companies nowadays and organizations are trying to reverse the effect. Again, targeting younger people, but trying to stop them from smoking because that stopping smoking would also stop secondhand smoking. Now, here are some other countries' examples. Austria and Italy just recently upheld a law in 2005 to stop all smoking in hospital premises. Studies have shown that this significantly improved the nicotine concentration and overall health in the hospital. This success carries over to more public areas and will slowly work their way to more areas. So in international areas, smoking laws are much more lenient than in the US, and basically they're basically trying to keep a more clean work area, just as we're trying to do here. Historical example is right in the US. In 1986, the US Surgeon General named secondhand smoking a serious health risk, and since then, the 1980s saw a ban of smoking on airplanes. This is a major step forward for secondhand smoking. Airplanes have no way to let the air out. Basically, people are constantly breathing in harmful carcinogens and toxic chemicals, and it was a big step forward for the United States. Public health in the future. So what should research literature say we should do? Well, we should enforce non-smoking areas and enforce no smoking near populated areas, not in the US, but internationally. Again, many ad campaigns talking about stop smoking, but in the US it's heard, not in international countries. A lot of studies have been done in countries like China, and while it's gotten better, secondhand smoking is still very prevalent in international countries, and new research is constantly being done there. The message has not been heard by everyone. My opinion, public health education can only do so much. At some point, strict laws must be put in place. We must enforce laws that prevent people from smoking with young children in cars or near around them. It is way too harmful for young children to be exposed to these harmful smoke. And we must also provide more information to people to helping to quit, not just telling them to quit. This is my references page. I hope you enjoyed. I hope you learned something. Thank you.